Normally people, even doctors, knowingly, unknowingly consume it and they die. Knowingly and unknowingly means knowingly they consume in order to commit suicide, and unknowingly means they are not knowing that they will die. ওরা ভাবে যে আমরা বেঁচে যাব, জাস্ট একটুখানি খেয়েছি, কিছু হবে না, বাট these are very lethal poisons. Okay, so we should know about it, as it is very commonly available. Commonly available means যে কোনো শপে ওষুধগুলো পাওয়া যায়, বিষগুলো। সো হাউসহোল্ড কেউ যদি বলে একটা ইঁদুর মারার ওষুধ দিন, তো the shopkeeper will provide you so instead of killing the rats and rodents, they might consume it also to commit suicide due to some problems in their households and so on. So you will get many cases of this poisoning by this poison. Okay, so one should be prepared how to handle these cases, and for your exam purpose also. So normally in exam, if this is given to you, normally they will provide you with this green color labeled product. So you should first write the identification part. First you should know what it is called. It is called as other names like Cellphos, Alphos, Camphos, okay, Quickphos, Phostoxin, Fumigant. All these are alternative names. Wheat pill, rice pill, they are available in two forms, in 3 gram pellets or tablets, or in 0.6 gram pellets. Okay, normally they are available commercially. So first you will write the identification. Okay, identification, these are normally grayish green tablet, and it has metallic taste, and its odor is garlicky, garlic like odor, রসুনের মতন গন্ধটা। Fine. So fatal dose is about 0.5 gram if it is ingested. Okay, one can inhale, one can ingest. যদি খেয়ে নেয় তাহলে it will be 0.5 gram or about 1 to 3 tablets. In some literature it is given 8 to 9 tablets, but 1 to 3 tablets can cause death also. So we'll take the lower threshold value. So that is for ingestion, and for inhalation it is about 400 to 600 ppm, parts per million, okay, in air. So why inhalation? Because this poison, means this aluminium phosphide, is used as an fumigant. Fumigant মানে কি, যেটা aerosolized হয়ে যেতে পারে, রাখলে vaporize হয়, দিয়ে it protects the grains and all. Okay, ওই যেগুলো রাইস গোডাউন থাকে, wheat গোডাউন থাকে, সেখানে এগুলো দেওয়া হয় to prevent the rodents. So in case somebody so in case somebody accidentally gets locked up in the godown where this fumigant has been given, there he might inhale and have this poisoning. Okay, so that's why inhalation. And ingestion is common. ইঁদুর মারা ওষুধ খেয়ে নিয়েছে কেউ, so it's common. Fatal period varies from 1 to 4 hours to 12 to 24 hours. Okay, the subject normally dies by 24 hours. Okay, so mechanism of action is very important for this poison. সব জায়গায় mechanism of action is not needed, but in this poison it is most important. Mechanism of action, mode of action, mechanism of action. The foremost thing যেটা তোমাদের বলতেই হবে, that is phosphine gas. Phosphine, PHOSPHINE, phosphine gas. So examiner will be interested in this term, phosphine gas. So let's learn about it. So normally each 3 gram tablet releases about 1 gram and 0.6 gram pellet releases about 0.2 gram of phosphine. Okay, phosphine gas on exposure to moisture. Moisture means water. Okay, so it reacts with water, moisture, and it also reacts with hydrochloric acid of the stomach. Okay, students, please keep quiet. Please keep quiet. All right. So, moisture and hydrochloric acid. So, once the poison has been consumed, it will go into the stomach, and as you know, in stomach it is always hydrated. So, it will react with water, or if there is HCl production, it will also get absorbed. So, the formula here, that is aluminium phosphide with 3 molecules of water gives aluminium hydroxide. If it was zinc, then it would have given zinc hydroxide and phosphine gas. Okay. If in case it reacts with hydrochloric acid, it will give aluminium chloride or zinc chloride with production of phosphine gas, and that this phosphine is the agent that cause all the problem. Okay, that is the poison. This phosphine gas that is generated, it causes many problems. I will just show you now. Okay, so the phosphine gas, it is very toxic to the cell. It interferes with the cellular metabolism. Okay, so how does it affects? It affects or inhibits the enzyme system. So 3 major important enzyme system that it inhibits are acetylcholine esterase, inhibition of peroxidase, and glycerol phosphate dehydrogenase. Okay, these are all interfere in the cellular metabolism. It inhibits the electron transport chain. Okay, that will cause cellular death. Electron transport chain, cytochrome 4 oxidase, complex 4 cytochrome oxidase. Okay, all these things. Therefore, the mitochondria will shut down and the cell membrane and all will collapse. Okay. So during this process, there are radicals generated. Radicals means jeta cellular damage kore, like superoxides, hydrogen peroxide, reactive nitrogen species and all. They all leads to cellular wall damage. Okay. So in cyanide poisoning e ki hoy? Mechanism of action. Potassium cyanide. Same, it also destroys the cell by inhibiting the electron transport chain. Fine. So it also affects in the same manner. So if we go in detail, as I told you, it inhibits the acetylcholine esterase enzyme. So esterase is to inhibit the acetylcholine normally. So if it is unregulated, then there will be more of excitation. Okay, so the patient may be having seizures due to it. Okay, then as you can see, just to make it in a gist, I have given few lines that will explain the whole what I have told just right now. It says that it reacts with gastric acid to form phosphine, which is a potent pulmonary and GI intoxicant. Okay, it inhibits the respiratory chain enzymes, electron transport chain, cytochrome oxidase, and forms highly reactive hydroxyl radicals, leading to cell necrosis and death. That is the gist of all that I told you right now, how it works and all. Okay. So now coming to signs and symptoms. Signs and symptoms. Normally phosphine gas is odorless, colorless. Okay, but when it comes in contact with air, it gives garlicky odor. Fine. So from the mouth of the patient you will get garlicky odor. Okay. There will be metallic taste, vomiting, burning sensation, burning pain, intense thirst and diarrhea. So don't give this patient water. Why? It will generate phosphine. As if you give them orally water, what will happen is it will react with water and form phosphine gas. Okay. So what are the systems it affects? It affects all organs. It causes multi-organ failure. Okay, multi-organ failure. So what are the systems? Like in CVS, there will be shock, hypovolemic shock, or it can cause pericarditis in a long term, congestive heart failure, heart block. So normally it is the shock that causes the death in early phase. Okay, cardiogenic shock. When it affects the respiratory system, it will cause ARDS, acute respiratory distress. Okay, distress, cyanosis will be there and cold clammy skin. Hepatic system, it will cause jaundice, hepatitis, you have to write all this, hepatomegaly. Renal system, it will cause acute tubular necrosis, ATN, and then it may cause renal failure. All the systems will be affected. Fine. CNS, that's common: headache, dizziness, tremors, paresthesia, altered mental state, restlessness, convulsions, encephalopathy, coma. Okay. And other systems may be affected like the pancreas, it may cause pancreatitis, then the adrenocortical insufficiency can be there, metabolic acidosis, DIC, all this can happen due to this poisoning. So it affects all systems. Mortality rate is about 90 to 100%. Okay, so it's very poisonous, very dangerous poison. So people knowingly consume that they want to commit suicide, but unknowingly that it is 100% fatal, and they eventually die, and they regret consuming it while dying. Fine. So most common cause of mortality within 12 to 24 hours is cardiovascular cause. Okay, and that is due to hypotensive shock or arrhythmias. After 24 hours, it is the liver failure. Fine. So how will you diagnose it? Diagnosing is first the odor. There will be a garlicky odor. Fine. Then there will be arrhythmias. So if you find a case where you find a young patient who has no history of cardiac diseases and he is showing arrhythmias in their ECG, you are viewing abnormality or arrhythmias in the ECG with no cardiac history of a young patient. So you should suspect of this poison. Fine. And there are tests like silver nitrate test. This can be done. You should remember the term silver nitrate. Okay, silver nitrate test detects aluminium phosphide poisoning. In details, if they ask, you may state. Okay. Then there is gas chromatography. Gas chromatography is normally not done. Okay, it's done post-mortem wise. Okay, in case the viscera has been sent, then they may conduct this gas chromatography and all. Fine, but you should know the term gas chromatography. And the level of cytochrome C oxidase can be seen in the platelets, and blood level for phosphine. As usual, anywhere, if you go for paracetamol poisoning, NSAIDs poisoning, we check the blood level of that poison. Okay, je kotota ache. Okay. That's how you diagnose. Now coming to the treatment part. So treatment part, first of all, there is no specific antidote for it. Okay, coming to the specific antidote, regarding abrin, raticids. So there was a question in your CA exam, the antidote for rati. Okay, so it will be anti-abrin antibodies. Okay, in normally many books it is not mentioned, but few advanced books they have given is that anti-abrin antibodies. Yeah, I know. So that's why it appeared in your CA exam. CA exam is not for normal people. Okay, so anti-abrin antibodies. So and fine. So let's continue. So treatment part. First we will treat the shock. If the patient is in shock, we give fluids and all. Then inotropics or whatever it is that will stabilize the patient, their blood pressure, their peripheral vasoconstriction or dilation, whatever it is, we have to regulate it to maintain the blood pressure. The shock should be treated. Then all organs are involved, so we will treat them symptomatically. Symptomatically means if the renal system is affected, we have to treat the renal system. If it is hepatic system, we have to treat the hepatic system. As it is, it causes multi-organ failure. So multi-organ failure is je kono jaygaye mane any system may be affected first. There is no specific order je ei bhabei progress korbe. So symptomatically one has to treat whatever it is. If there is ARDS, you will go for the respiratory system. You may have to put them in ventilator or so and so. Cardiac system, arrhythmias you have to correct. Okay, depends what kind of arrhythmia they are in. So there is no specific like we can give this, we can give that. It is all symptomatic. How the patient is at that state. Okay. So gut decontamination should not be performed without airway protection. So if you put a Ryle's tube and all, that should be done with airway protection, as same in carbolic acid. Okay, where there is an anesthetic effect due to which that there could be aspiration. So there also we can put the Ryle's tube and all with precaution. Okay. Another thing, potassium permanganate is used as it oxidizes phosphine to non-toxic phosphate. Okay. So if in case you give gastric lavage, then you use potassium permanganate solution 1:10,000 dilution, and this will convert the phosphine, means it will oxidize phosphine to non-toxic phosphate, and that will get eliminated. Okay. Later on you can administer charcoal, activated charcoal. Okay. Copper sulfate can be used as it will precipitate as copper sulfide, and this will be eliminated as not harmful. Fine. Medical legal aspects, very simple. It is used commercially as rodenticide, insecticide, fumigant. Okay. And in non-judicial use, accidental, yes, it may be if it's consumed by the children accidentally. Homicidal, yes, it may be if it is given in food and it is mixed with food and given, homicide can be done, because it is not bitter, it is metallic in taste, so it can be. And suicidal, it is a very common agent because it is readily available at home. So suicidal, it is common. Fine. So this topic, aluminium phosphide, is also aluminium phosphide and zinc phosphide has the same feature. ठीक है? So if the question comes as zinc phosphide, don't get frightened. You write aluminium, means all the things, only substitute the word aluminium and put the word zinc. Okay. In the formula also, mechanism action, substitute it for zinc. Okay. Same, phosphine gas will be produced if zinc phosphide is been given. So cellphos is normally available at the moment, means এখন cellphos ही पावा जाए. So I have put this one in your syllabus. Fine, clear? And organophosphorus has been covered, right, in lecture classes. So you are left with the postmortem part that we are working on. We will see what we can do. And death certificate writing has been covered in lecture, I guess. Lecture class se cover hoye geche death certificate কিভাবে লিখতে হয়, say 1A, 1B, 1C, all those things the external will ask. Okay, so be prepared. আর কি আছে? Other formats we have learned. Injury report writing we have learned. Only postmortem is left out. So there will be 10 forms, 10 postmortem forms. Okay, 10 types of cause of death. For that you have to fill out. We'll hand over to you the format. You have to fill out, everyone. Okay, and keep it with you.